Nursing is a noble and rewarding profession, but it also comes with its own set of challenges and stressors. Long hours, heavy workload, and high-pressure environments can take a toll on even the most dedicated nurse. The result is a high rate of burnout and turnover in the nursing profession. One of the main reasons for nurse burnout is the high level of emotional and physical demand that the job requires. Nurses are often the primary caregivers for patients and are responsible for their physical and emotional well-being. This can be extremely draining, especially in the face of challenging cases, demanding patients, and demanding family members. Another factor that contributes to nurse burnout is the lack of control and autonomy in their work. Nurses are often required to follow strict protocols and procedures, which can limit their ability to make independent decisions and use their own judgment. This can lead to feelings of frustration and helplessness, which can contribute to burnout. Workload is another significant factor that contributes to nurse burnout. Nurses often work long hours, including night shifts, weekends, and holidays. This can disrupt their personal lives and contribute to feelings of exhaustion and burnout. In addition, they may also be responsible for a large number of patients, which can make it difficult to provide quality care and attention to each individual. Poor working conditions and low pay are also major factors that contribute to nurse burnout. Nurses may work in overcrowded, understaffed facilities, which can result in increased stress and burnout. In addition, many nurses are underpaid for the critical role they play in patient care, which can lead to feelings of dissatisfaction and frustration. Nurse burnout and turnover is a significant problem in the nursing profession, and it's essential to address the underlying causes to reduce the impact on nurses and patients. Providing adequate support, resources, and recognition to nurses, along with addressing the systemic issues that contribute to burnout, can help to mitigate the impact and reduce the rate of nurse burnout and turnover. If you're interested in learning how to start your own staffing agency, we highly recommend you enroll in this best-selling course. Click the link below to learn more. If this information was useful to you, please consider pressing like and subscribing to our channel. Thanks for watching. Take care.